Welcome to this explainer. Today, we're unpacking something pretty amazing, the revolutionary promise of artificial disc replacement. It's a modern surgical alternative for chronic neck and back pain that's a real game changer. But we're also tackling a massive misconception head-on, the idea that you can simply age out of this procedure. If you've ever been told you're just too old to preserve your spine's mobility, well, you're definitely going to want to pay close attention to the science we're about to break down.
Here's our clear roadmap for today. We're going to cover the promise of motion. Is there an age limit? Bones over birthdays, frailty and surgical risk, and finally, the comprehensive evaluation. Don't worry, we're breaking down all these complex medical criteria into totally digestible steps.
Okay, let's dive into this. Section 1, the promise of motion, going beyond traditional fusion. So for decades, the absolute gold standard for severe disc disease was basically to stop the pain by stopping the movement altogether. Spinal fusion permanently joins vertebrae together. Now, it's a proven method, absolutely, but it does increase biomechanical stress on the adjacent vertebrae over time. On the flip side, we have artificial disc replacement, or ADR. This procedure seeks to mimic the natural movement of a healthy spine. It removes the damaged disc and inserts an implant to relieve pain, all while preserving your natural flexibility and range of motion. It's really about keeping you moving.
Now, finding specialized, non-fusion care is a huge milestone for patients. You want unbiased advice from an expert, like Dr. T, a highly specialized Asian spine surgeon with elite, dual fellowship training in neurosurgical spine at Stanford University and orthopedic spine at the Texas Back Institute. Candidates seeking this level of incredibly specialized care are typically adults suffering from really debilitating pain, folks who haven't found any relief from at least 6 months of conservative treatments, things like physical therapy, medications, or injections.
Moving right along to Section 2, is there an age limit? Addressing the primary anxiety.
It's an entirely valid concern. You might be wondering, am I just too old for an artificial disc? Because if you look at standard medical guidelines and FDA trial demographics, they traditionally suggest that the ideal candidate is somewhere between the ages of 18 and 60. So when a patient in their mid-60s reads that, they instantly think, well, that's it, I'm disqualified. Now, what's really interesting about this is the layman's reality hidden beneath those standard guidelines. 60 is not a hard stop, no way. In fact, healthy individuals up to age 70 can still qualify for artificial disc replacement. Chronological age alone is just not a strict barrier to entry, and that leads us perfectly into what spine surgeons are actually looking for when they evaluate you.
Which brings us to Section 3, bones over birthdays and what actually matters.
We really need to look past the year you were born. When an experienced surgeon evaluates you, your physiological health matters far, far more than the chronological number printed on your driver's license. Think about it. A 65-year-old who is active, has great muscle strength, and excellent structural spine integrity is a vastly better candidate than a 45-year-old with severe bone weakness or multiple systemic health issues. The whole thing hinges on the structural integrity of your spine. Can it actually hold the device? If there is one single number you should remember from this explainer, it's not an age. It's negative 1.0. This is a DEXA bone density T-score. Avoiding a T-score of negative 1.0 or lower is a critical make-or-break deciding factor for artificial disc surgery. If your score dips below this threshold, it fundamentally changes your surgical options. So why is that number absolutely crucial? Well, a score lower than negative 1.0 indicates osteopenia or osteoporosis, conditions where bone density is significantly weakened. Let's use a really simple analogy. Think of it like building a house. You wouldn't build a beautiful new house on a crumbling, unstable foundation, right? Similarly, excellent bone quality is strictly required to support a new titanium or cobalt chromium artificial implant. If the bone is too soft, you risk what surgeons call subsidence, which is where the implant literally sinks right into the vertebra, leading to device failure and some severe complications.
Let's move to Section 4, frailty and surgical risk, the true gatekeeper. And this brilliantly illustrates that if age isn't the gatekeeper, frailty absolutely is. According to clinical studies, increasing frailty is significantly associated with major complications. In fact, higher frailty scores multiply the odds of severe, life-threatening complications by over 40 times. That is massive. Age is just one tiny piece of the puzzle here. Your overall resilience, your ability to heal, and your physical vigor are the true predictors of surgical success.
To break it down simply, ideal candidates generally have good bone density. They're active, and they have isolated disc disease at just 1 or 2 spinal levels.
On the flip side, the physical realities that dictate disqualification include things like severe osteoporosis, spinal instability like spondylolisthesis, or major deformities like severe scoliosis. Active infections or a history of major abdominal surgery can also completely rule you out for lumbar replacements. At the end of the day, it's your physical anatomy that dictates the outcome.
Let's move to and see how this builds into Section 5, the comprehensive evaluation and your next steps.
So, how do doctors actually figure out if you're a good match? It takes a rigorous, multi-step clinical assessment. It goes way beyond just chatting about your symptoms. First, a spine specialist will dive deep into your medical history and conduct a physical exam. Then comes the imaging. An MRI provides a crystal-clear view of your soft tissues, the discs, and the nerves. A CT scan offers detailed images of your bone structure. And of course, that DEXA scan we talked about to check that crucial bone density T-score. Together, these tests act like a giant puzzle, creating a complete three-dimensional picture of your unique anatomy.
I really want to emphasize this quote directly from the source material. Every patient's spine and condition are unique. The ideal surgical path depends on a complex interplay of factors. You are not just a number on a chart, and you are certainly not just your age. Your care has to be highly individualized, carefully weighing the potential for motion preservation against the stability offered by fusion.
So here's the crucial question we want to leave you with today. Does your physiological health make you a candidate for motion preservation? Please, don't dismiss yourself simply because of the year you were born. Focus on your bone health, your fitness, and seek out a comprehensive evaluation from a spine specialist to discover what is truly possible for your unique spine. Go ahead and call 602-833-2141 to schedule a consultation today. Thank you so much for joining us for this explainer, and keep learning.